Hello and welcome to our video on the prevention and management of diabetic foot and diabetic foot ulcer. As we know, diabetes can cause a number of complications, including damage to the nerves and blood vessels in the feet, which can lead to serious foot problems. However, with proper care and management, many of these complications can be prevented or minimized. In this video, we will be discussing some important tips and strategies for preventing diabetic foot and diabetic foot ulcer, as well as effective management techniques if you do develop these conditions. Whether you're living with diabetes yourself or caring for someone who is, this video is sure to provide valuable insights and information. So, sit back, relax, and get ready to learn all about the prevention and management of diabetic foot and diabetic foot ulcer. Prevention and management of diabetic foot and diabetic foot ulcer require a comprehensive approach that addresses both the underlying causes and the symptoms of these conditions. Here are some tips for preventing and managing diabetic foot and diabetic foot ulcer. 1. Control your blood glucose levels. Keeping your blood glucose levels within a healthy range can help prevent nerve damage and poor circulation that can lead to diabetic foot and diabetic foot ulcer. This can be achieved by following a healthy diet, getting regular exercise, taking medications as prescribed by your healthcare provider, and monitoring your blood glucose levels regularly. 2. Check your feet regularly. Inspect your feet daily for any cuts, sores, or blisters. Use a mirror or ask someone to help you if you have trouble seeing the bottom of your feet. If you notice any wounds or abnormalities, contact your healthcare provider immediately. 3. Wear proper footwear. Wear shoes that fit well and provide adequate support and cushioning. Avoid high heels and shoes with pointed toes, as they can increase pressure on the feet and cause blisters or sores. Choose shoes made of breathable materials that allow air to circulate around your feet. Wear socks made of natural fibers, such as cotton, that can absorb moisture and keep your feet dry. 4. Practice good foot hygiene. Wash your feet daily with warm water and mild soap. Dry your feet thoroughly, especially between the toes. Apply a moisturizing cream to keep your skin soft and prevent cracking. Avoid using hot water, as it can damage your skin and cause burns. Do not soak your feet for long periods, as it can soften the skin and make it more prone to injury. 5. Trim your toenails carefully. Cut your toenails straight across and file the edges. Do not cut the corners of your toenails or dig into the sides of your nails. If you have difficulty trimming your toenails, ask your healthcare provider or a podiatrist for help. 6. Stop smoking. Smoking can worsen circulation problems and delay wound healing. If you need help quitting smoking, talk to your healthcare provider. They can recommend resources and support groups to help you quit smoking. 7. Manage other health conditions. Control high blood pressure, high cholesterol levels, and kidney disease, as they can increase your risk of developing diabetic foot and diabetic foot ulcer. Follow a healthy diet, get regular exercise, take medications as prescribed by your healthcare provider, and monitor your blood pressure and cholesterol levels regularly. 8. See a healthcare provider regularly. Schedule regular checkups with your healthcare provider to monitor your blood glucose levels, blood pressure, cholesterol levels, and kidney function. They can also perform a foot exam to check for any abnormalities or signs of infection. If you have a history of diabetic foot or diabetic foot ulcer, your healthcare provider may recommend more frequent checkups. 9. Seek prompt treatment. If you notice any signs of infection, such as redness, swelling, or discharge from a wound, contact your healthcare provider immediately. They can prescribe antibiotics or other treatments to prevent the infection from spreading and causing further damage. In conclusion, diabetic foot and diabetic foot ulcer are serious complications of diabetes that require careful prevention and management. By following these tips, you can reduce your risk of developing these conditions and maintain healthy feet. Thank you for watching our video on the prevention and management of diabetic foot and diabetic foot ulcer. We hope that the information we've shared has been helpful in understanding the importance of taking care of your feet when living with diabetes. As we discussed, preventing diabetic foot and diabetic foot ulcer is crucial to avoiding serious complications. By following the tips and strategies we've outlined, you can reduce your risk of developing these conditions and keep your feet healthy. If you do experience symptoms of diabetic foot or diabetic foot ulcer, seeking medical attention right away is key to effective management and treatment. With the right care and support, it's possible to minimize the impact of these conditions and prevent further complications. We appreciate your interest in learning more about this important topic and hope that you found our video informative. Be sure to like and subscribe for more valuable insights and information on managing diabetes and related conditions. Thank you for watching.